Huntington disease is a genetic neurodegenerative disease. It affects mostly the brain, but ultimately I think it affects the whole person. So it affects how the person can move, it affects how the person thinks, and it affects how they feel. And so as the disease progresses, the impact of it will affect different aspects of the individual. And so it will change how that person lives in the world and interacts with their family members and is able to do things. And so the disease doesn't end up only affecting the person. I think the disease also affects a whole family. And so Huntington disease, I think, is far-reaching. It is genetic, so it does pass from one generation to the other. But I think it also affects multi-generations of a family because of the impacts of the progression of the disease. Juvenile Huntington disease is Huntington disease, but it presents at a much earlier age. And so usually the onset of HD is between the ages of 35 to 55, but with juvenile Huntington disease, it shows up usually before the age of 20. And so it affects the younger person at a much younger age, and it actually progresses quicker than the adult onset of the disease. Juvenile Huntington disease is also much more rare, but it does occur. And so because of that, it sometimes can take a little bit longer for a diagnosis of juvenile Huntington disease, but folks can still contact their HD clinics and their RCDs for information about juvenile Huntington disease. Late onset HD is HD where it appears at a later stage in life. And so normally it would show up between 35 and 55. The symptoms would start at around that age. In late onset, we'll see the symptoms appear after the age of 60. And so again, this is a smaller portion of our HD community, but with late onset HD, the progression is much more slow. And so the symptoms would appear much at a different rate for those folks. And often people may end up passing away from something other than their HD because of just the different diseases in that age bracket.